Hi, I'm Reena. I'm an occupational therapist. I work with special children, mainly autism. I learned EFT because I thought it would involve some kind of tapping so I can tap on those kids and help them. Then I later realized that it has some bit of counseling element to it, which is the most important along with tapping. I've been using EFT with kids and I'm seeing great results. Most of the times it is a projection of the parents that is passed on to the kids, the toxic emotions which pass on to the kids unknowingly, unintentionally, and when those emotions are cleared in the parent, or when we do surrogate work, where parents work on behalf of kids, I'm seeing huge results. I've had kids where, they had issues like constipation, or they had issues with respect to sleep, they had anxiety. Most of those issues I see are getting resolved because we've been working on the emotions which kept those issues in place.